Today, we are going to be talking about mental health. It is Mental Health Awareness Month. My name is Natalie Lonis. I am the Director of Public Relations for Latinicidad, and today we have our guest speaker, my friend Juanita Carvajal. Juanita, say hi.
Hi. Sorry, I'm a little congested today, but yeah, thank you so much for having me. I mean, I've been doing a lot of speaking events this month just for, you know, reiterating the importance of us focusing on our mental health and knowing how to seek quality treatment, especially for our loved ones and ourselves.
Yeah. Why don't you give everybody like a little bit of background as to what you do and where you work?
Okay. So I've been working in the mental health field for over 10 years, focused on community mental health, which is outpatient, working with children and families of diverse backgrounds. We work a lot with, children that have been adopted in foster care or also just experience a lot of trauma. So we do focus on populations that are lower income, probably require a little bit more intensive treatment sometimes. But my role is to kind of link our families to quality services and providers. So there are different types of treatment options at our agency. There is obviously the first is mental health counseling, and that's, talk therapy, CBT. There's different type of modalities our clinicians use, but there's also a program called psychosocial rehabilitation, and that's more hands-on activities for people that need to work on social skills, independent living skills, and med management. But we also offer free support groups for our community. So sometimes for people that are not quite ready to start counseling or there's a little bit hesitation, there are support groups to work on your mental health, whether it's dealing with grief, self-esteem or parenting. There's some type of life adjustment. There's, maybe you recently had a chronic illness and now you're adjusting to a completely new life. So there's a lot of adjusting in that, and it does affect your mental health. I'm also a registered yoga teacher because yoga is obviously one of the biggest coping skills someone can learn when dealing with their mental health. Also, there's a lot of good breathing techniques and different lifestyle adjustments that people can do just to cope and maintain their mental health. Just like your physical health, like if you're trying to, improve by eating healthy, exercising, you also have to maintain your mental health,
Yeah.
by,
Well,
also exercising and eating healthy, but also disconnecting from, something from unhealthy environments or doing something like journaling to kind of express things that maybe you don't feel comfortable talking to someone quite yet.
yeah. Well, before we get really, I mean, you did mention a lot of ways for someone to deal with mental health and the different coping mechanisms, but I really want to engage in a discussion relating to the issue behind the stigma that Latinos have in our community. There's a big stigma on going to therapy, going to see any kind of mental health counselor. And what are your insights relating to that? Because I mean, I'll admit I'm not, I'm definitely someone that's dealt with that in my own family. And how would you suggest someone to handle that kind of a situation?
So thanks, Natalie. So culturally, we are a little bit more stubborn, quote unquote, when it comes to healing our mental health. Like we either label it as, oh, that's crazy, or oh, that's not for me, or oh, I can handle this myself. Like, why would I want to talk to a stranger about my problems? So, our community, we're still kind of bridging the gap of pertaining to the stigma. Like we still think some of us, I'll say I statements, like some people still think that, it doesn't pertain to them because they're not at a crisis level, or they haven't lost their mind, or, they don't need medication. But in reality, like we want to take those preventative approach to, take care of our mental health
Yeah.
because it does affect our physical health. So the stigma is still prevalent. You know, our cultural background, it's like a lot of times you use religion or you talk to your family first, but sometimes your family kind of invalidates your emotions or doesn't really understand how to quote unquote like give advice to people that like our younger generations that are also adjusting to different, you know, modalities. Like the issues that we're dealing with are completely different to the issues that they were dealing with throughout their generation. So